Avian origin influenza A H7N9 virus infection. H7N9 is a designation used for a subtype of influenza commonly found in poultry virus but does not normally infect humans. Like all of A influenza virus, different strains of H7N9 virus. From the end of March 2013, China began reporting infection in humans and birds, with a new strain of H7N9 virus very different from the H7N9 virus previously observed. Does the new H7N9 strain infect humans? Yes, China reported more than 126 cases of human infection with this new H7N9 virus.
Of human-to-human transmission. Chinese scientists say the new strain of the bird flu virus may have evolved from at least 4 origins. The H7N9 virus has infected 129 people in China and Taiwan. 27 of them have died so far. Researchers at the Chinese Academy of Sciences and other institutions announced their findings in the medical journal Lancet. They say the H7N9 virus might have genes originating from ducks living in Shanghai and other areas near the mouth of the Yangtze River. The virus also may have genes transferred from migratory birds infected with avian flu viruses. The researchers analyzed the genomic sequences and found that the H7N9 strain likely evolved from at least 4 bird flu viruses. They say ducks probably acted as the intermediate hosts to transfer the virus from wild birds to domestic birds. Health authorities are closely watching for the possibility of human-to-human transmission.
How do people become infected? In China, this virus was detected in birds, in some of the same areas where there were cases of human infection. The available evidence indicates that most people contract the virus after coming in contact with infected poultry or contaminated environments. How they contract the flu virus? People through the stool or mucus. If someone was in contact with infected poultry or contaminated environment with virus and touching your eyes, nose, or mouth, they could become infected. There is evidence that the infection can also occur if the influenza virus is transported by air and some way, such as infected birds flap their wings. If a person breathes, if the virus particles are transported by air, you may infect. How serious is infection with this virus? Most reported cases of human infection with this virus have been seriously ill. There are also reports of some cases of Miller disease and a possible report of a person to whom the test was positive but the virus had not presented any symptoms.
Hello, I'd like to provide a video abstract of an epidemiological investigation did by Jiangsu Provincial for Disease Control and Prevention. The topic of this study is probable person-to-person transmission of novel avian influenza A H7N9 virus in eastern China, 2013. First, I will brief in.
What are the symptoms of disease caused by this virus? The symptoms start with fever and cold. Many cases became very serious illness, including severe pneumonia, acute respiratory distress syndrome, septic shock, and multiple organ failure leading to death.
So, in conclusion, the infection of the daughter is likely to be resulted from the index patient during unprotected exposure. And we suggest that the NAIV possesses the ability to transmit person to person in this cluster. However, the infectivity was limited and non-sustainable as there is no common outbreak following the 2 cases.
Can this virus be spread from person to person? Yes, it is possible and even likely that there are few cases of infection from person to person with this virus. Is there a vaccine against this new H7N9 virus? No, there is currently no vaccine to protect against this virus. The CDC and after research are working to develop a candidate virus for influenza vaccine that could be used to create a vaccine if necessary.
The novel avian influenza H7N9 virus has caused great morbidity and mortality since its emergence in China, February 2013. And animal experiments indicate that the novel virus can transmit through droplets under certain conditions. However, there is no definite evidence showing that the novel virus can transmit person to person yet.
Are there medicines to treat the disease associated with this new virus? CDC recommends oseltamivir and sonamivir. It is likely that most of the H7N9 viruses that have been studied are susceptible to the two influenza antiviral medications that are used to treat seasonal influenza. These drugs are oseltamivir and sonamivir.
Here is a time flow of exposure and infection. The index case became ill on March 8 and was admitted to hospital 3 days later. Here. The doctor first provided conventional care at home and then visited in hospital without PPE. Later, she provided bedside care without PPE from March 14th until her father was transferred to ICU. The daughter became ill on March 21st. The period of most likely to be exposed for the daughter was from March 13 to March 15th.